My name is Chetan Immanneni, and today I'm going to be talking a little bit about medical records and whether they can be truly considered secure in our current time. This presentation is largely due to the support of the Buchanan Fellowship, part of Vanderbilt University. So, a brief intro. You really can't fully understand the current situation of health information and exchange without understanding HIPAA, or the Health Insurance and Portability and Accountability Act of 1996. This was a landmark piece of legislation, but the truth is that it wasn't really great because it is quite old, considering our time, for complicated issues such as health and information exchange across tablet devices. The ACA, or the Affordable Care Act, which is much more recent, truly incentivized the transition to electronic health records and really didn't act on the fundamental issues that HIPAA had. So, two main questions that I'm going to be considering in this presentation are, is our focus on EHRs justified? And how can private organizations get involved in a positive way? Or are they having a positive impact? So to answer the first question, it's very important to recognize the context that data breaches are extremely widespread. It's estimated that they cost at least $6 billion every year to the United States. Furthermore, physician use of an EHR has correspondingly increased only from this time period, from 18% to 57% in 2011. So, is the EHR movement a good thing? The truth is that it's very important to recognize that a lot of costs were spent in the transition, and the focus was quite a bit on centralization, on having one source for all health information for a number of patients, for providers. But this truly has recently become a point of controversy because it's so much more easy now to have access to the entire system by attacking it at one point. So it's also important to recognize the role that private interests can play. This is truly a complicated issue because there have been instances in which private companies have taken advantage of the current system. But overall, it's very important to recognize that private organizations have generally served to help amplify the current systems in place, but they've done those in a way by introducing different technologies that businesses and other organizations have routinely implemented. For example, Project Hosts was one of the top 10 healthcare cybersecurity companies of 2018, and its focus has primarily been about shifting to the cloud. AM LLC is another well-reputed company that provided protection by closely working with the federal government. So this concludes my presentation about medical records and whether they can truly be considered secure. The truth is that support needs to be provided from a number of sources. One thing that you can get involved is by going to healthcarait.gov and looking for yourself whether your healthcare information across a number of devices or across the number of providers that you may be visiting is truly secure. So with those resources, you can consider the issues a bit more, but it's very important to keep a wide perspective with a big issue like this.